people to speak to you today, including Dr. Linda Bell, Dr. David Cole, Dr. Stephen Shelton, and Stephen White of DHEC. I'll start off with some comments on several points. The first is these are all important issues. And as you know, our state Supreme Court has issued a decision some time ago concerning the CARES Act funds. Obviously, I'm very disappointed with the decision. We had a rehearing, and still we were disappointed with that decision as well. Most importantly, I'm disappointed for the 5,000 or so students from working in low-income families who will be denied any financial aid from the CARES Act through the SAFES grant program that we initiated. That was $32 million. Many of these parents are barely able to scrimp and save enough money to pay for their child's tuition in independent Christian and other private schools. They do it to provide the type of education, environment, and instruction that they feel best suits the child's unique needs, and there are a lot of those. During this pandemic, with so much uncertainty and anxiety facing families, a child's displacement from the school they love and thrive at could have devastating consequences to their learning and emotional progress. I'm also disappointed that because of this decision, our independent and private colleges, including the historically black colleges and universities, will, as a result of this decision, be unable to access the CARES Act relief funds. I hope that this question can be resolved in some manner and resolved soon, perhaps by legal action by those institutions. I'd like to point out that it has been a common practice over the years for the General Assembly to appropriate money to benefit students at private and independent and Christian schools and colleges in South Carolina. And this includes need-based grants and financial aid, as well as scholarships funded with revenue from the state lottery. We do have a contingency plan for repurposing the CARES Act funds. They will be directed at providing educational opportunity, choice, and access for students from working and lower income families who have been adversely impacted or displaced due to the COVID pandemic. As to schools, South Carolina must have an educated and trained workforce to compete for jobs and investment. And the competition for jobs and investment in the southeastern part of the country is going to be fierce as it was before the pandemic hit, and this will go on into the future. We cannot afford to keep schools closed at all any longer. We can't afford it for as long as we've had them closed. In July, I called on all the public school districts to give parents the option to send their children back to school in person 5 days a week, or the option to choose virtual instructions. Some schools did it, most did not. To keep classrooms open and safe, I directed the Department of Administration to provide personal protective equipment for every school district that requested it. This was months ago. We have repeatedly offered to provide whatever personal protective equipment any of the school districts wanted. And Kim Stinson is here with the Emergency Management Division. We have millions of gloves, masks, all of that, and it has not been requested. There's a lot available now on the commercial market, but there's no reason for these schools not to be opening if what they need is personal protective equipment, because we have an abundance of it. Over $10 million in PPE was shipped out this fall in response to my offer. School districts in our state have also received over $400 million in CARES Act funds to help bring the students back to the classroom. 2 weeks ago, I directed the Department of Health and Environmental Control to provide every school district with COVID-19 rapid tests. Those are the BINEX tests. For many South Carolina families, schools provide the only opportunity for parents to go to work. The only opportunity. Many working parents cannot stay home with their children every day. They must go to work to pay the bills and provide for their families. Parents should not have to choose between their child or their job. But that is what the decision of the school districts who have not gone back to 5-day face-to-face education are requiring these parents to do. And it is not the right thing to do. In October, my office surveyed the 15 school districts that started the year providing in-person instruction. That's 15 school districts out of 79 that started the year with in-person instruction. This was done to learn what practices and policies were working, which ones were not, and what, if any, additional support was needed to ensure the continued safety of the students, teachers, and staff. The answer was continuous communication with teachers, staff, and parents across numerous media platforms allowed these districts to adapt and evolve their health and safety policies and procedures in order to keep the students in the classrooms. The students, the parents, the teachers, the districts were communicating, collaborating, and cooperating, and they've opened safely, and they've been doing just fine. And also in our private school system, independent school system that serves approximately 50,000 students, they have, I believe 99% of them have been open 5 days and have had very few, if any, problems. This week, I sent a notice of upcoming results of this survey to every school district superintendent in the state and encourage them to share the survey with their local school board members. It is my hope that this information will help them provide to parents the option of 5-day in-person classroom instruction. The survey is available now at accelerate.sc.gov. Ladies and gentlemen, there's very little that I can do to open these schools that we have not done. I do not have the authority to make the school districts make that decision. I cannot do it because I do not have the authority. Had I the authority, I would have done it a long time ago. But there's ample personal protective equipment. There are ample procedures and policies that have been used successfully. These children not being in school are having enormous unintended consequences. People all over our state are going back to work. We have a 4.2% unemployment rate. People are working. There's no reason for these schools not to be open. The consequences of these children, some of whom were marginal in their learning to begin with, the consequences are going to be enormous, and we cannot afford that. We've got enormous competition, fierce competition, economic. We've got to educate our people for the skills, the education, the things that they need for the future if our future is going to be bright. Across the nation and in South Carolina, infections and hospitalizations are rising. It appears that many people have let their guard down. I know we have fatigue from all the things that we need to do, but now is not the time for us to let up. Now is the time for us to redouble our efforts. When the cold weather comes, people go inside with the windows shut, with a lack of circulation, and that's where this virus spreads. That's when when they're close together in various settings, that is the best opportunity for this virus to spread. So that is here, that is upon us now, but we know what to do. We have learned over the months, we've heard repeatedly from this podium as well as others around the country what we need to do. What we need to do now is determine that we're going to follow those best practices and keep the spread of this virus down. Wearing a mask when social distancing is not possible. Washing your hands routinely. Being courteous to others, courteous to your family members, courteous to visitors, courteous to your customers. Go outside, get fresh air, keep your windows open, but follow those rules that have been stated so often that we've all memorized them by now. Following successful procedures and protocols has allowed our schools, businesses, restaurants, manufacturers, and our state government to operate safely and securely. Again, we need to redouble our efforts. Vaccine. This month, the Department of Health and Environmental Control will begin receiving the vaccine this month, December. It is estimated that our state's first allotment will be between 200 and 300,000 doses. I want to caution everyone, this will not be a fast process. I want to caution everyone, this will be a slow process all over the country. Most South Carolinians will not be vaccinated for months, so we've got to keep our guard up. Now is not the time to let our guard down. There are different phases or steps in this process of delivering the vaccine. The first step, the first phase, called Phase 1A by the CDC, to receive the vaccine will be the workers or individuals in healthcare settings that are at the highest risk of contracting COVID-19 and are essential to preventing mortality of others. Some examples are, and there are a lot of them, I'll read them slowly, but these are the example of the first group that will be receiving the vaccine in South Carolina and elsewhere according to the CDC rules, regulations, and recommendations. The first group will be, and there won't be enough of the vaccine for all of these, as you understand, physicians, physicians' assistants, nurses, nurses' aides, physical therapists, respiratory therapists, speech pathologists, medical students, nursing home and long-term care facility residents and staff. Also, medical personnel in correctional facilities, jails, and detention centers. Also, this is Phase 1A, the first step, medical emergency first responders such as EMTs, paramedics, fire, and law enforcement personnel. I hope that was slow enough for everybody to get it. Also, home health and hospice workers. Those will be in the first group. The next group will be workers or individuals who provide services and which have a high risk of exposure due to interactions with the public. Examples include, again, I will read them slowly. The remaining first responders, including fire and law enforcement personnel that don't have face-to-face contact in emergency situations with the public. Workers in jobs that provide critical services such as utilities workers, water, trash, transportation, waste removal. That includes bus drivers, Department of Transportation workers, and others. Also, in this second phase, agribusiness and food production workers. We have to keep those providing the food for the rest of us. And those will be in processing plants, canning facilities, and others involved in food production. Persons who live or work in congregate settings like group homes, homeless shelters, correctional facilities, jails, and detention centers. Also, in this is Phase 1B under the CCC's statement. I would call it the second step, a second group. This continues to include people aged 75 or older and persons with 2 or more of the following risk health conditions. These following conditions: cancer not in remission, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV/AIDS, obesity, pregnancy, and sickle cell disease. 2 or more of those. The next group, Phase 2 it's called, includes this: pharmacists and pharmacy technicians, grocery store, food service and food delivery workers, service industry workers, postal workers, public transit workers, K-12 school teachers and school staff, child care workers and staff, school bus drivers. Are you getting all this, Ms. Burkett? Okay. Instructors and staff at higher education institutions, including 4-year colleges, technical colleges, and research universities, persons age 65 or older, and finally, persons with one of the following health risk conditions. And you heard these a moment ago. Cancer, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV/AIDS, obesity, pregnancy, sickle cell disease, asthma, cerebrovascular disease, good gracious, corticosteroid. How you say that? Corticosteroid. That's it. Cystic fibrosis, hypertension, immunocompromise, liver disease, and pulmonary fibrosis. So that's a little longer than the first list. But you have to just have one of those. The final phase will make the vaccine available to the entire population, which includes the vast majority of the population. But again, what we have to remember is that this is going to be a slow process. Now we have worked on our distribution system for the vaccine for some time. We are confident that among DHEC, the EMD, and the National Guard, it will work, and we're ready to do it. But we urge everybody to have patience and want to remind everyone that even though the vaccine is coming, that we've got a long way to go before we have managed our way out of beyond this virus. So I urge everybody again to remember those simple things that you're supposed to do. Wash your hands, keep your hands away from your face, you pick things up from things you touch, wear that mask, keep your social distance, and try to get as much fresh air and stay outside as much as you can. With that, I'll turn the program over to Dr. Linda Bell from DHEC.